HIT Foundation is on a mission to solve key issues in healthcare, such as centralization of data and data privacy. They developed a blockchain-based marketplace, an open platform to align the interests of all stakeholders while putting individuals in the center of healthcare. The company is identified as one of the blockchain projects for social good by the New Economies show at Nasdaq. Next on stage, HIT Foundation.
Good morning, everyone. Good afternoon, everyone. My name is Elizabeth, co-founder and CEO of HIT Foundation.
And I'm Vega Petenkar. I'm the CTO of HIT Foundation.
So we are a blockchain-based health tech startup based out of Switzerland. Pleasure to be here today. So I'll be walking you through our business and our value proposition, while Vega will lead us through a live demo. So we provide a platform that matches those who are seeking health information with those who provide the information and ensure that these providers, who are usually individuals, get paid for it. When we talk about health information, inherently it involves health data. And health data in itself is actually a very broad definition. It's more than just your clinical data and your patient health records. It also involves your lifestyle and fitness, real-world evidence, true patient self-reported outcomes, as well as genomic data such as your DNA. We founded the startup to actually address 4 key challenges plaguing health data today. Firstly, centralization of data, where everyone's in your silos and there's no sharing of data. Secondly, it's a lack of real consent, where individuals, you and I, that our consent gets abused and taken for granted. Thirdly, something that's even more endemic in the system is that there's actually a lack of incentives for us to digitize our own health data. 95% of the time, when we're healthy, generally we don't care, we take it for granted that our data is sitting out somewhere. But it's usually that 5% when you're sick, when you really need it, it's too late. Last but not least, access. Whether you have access or lack of access. And if you do actually have access, whether you have timely access. So these challenges are actually not unique to any particular stakeholder group in healthcare. It actually also impacts insurers. The good news is, thanks to our platform, our mobile solution could actually help you to incentivize data gathering via surveys to help you to mitigate your risk and to facilitate risk-sharing agreements. We also support outcome-based reimbursements by helping you to monitor your performance indicators, the effectiveness of treatments that would ultimately trigger the reimbursement for that particular treatment or technology. You could also leverage our app to detect the burden of illnesses, potential unmet needs, to also identify different patient segments to help you with risk stratification. Through our platform, you can also grow your user base by cross-selling to other partners who already have established user bases. This ultimately opens up new revenue streams for you as we help to augment your solutions and services. So for more info on use cases, please refer to our white paper on our website. And without much further ado, I'm going to hand the stage over to Vega, where he'll walk you through version 1 of our MVP, its newly launched app, to show you how it works, what you see as an end user versus what you see as the data seeker. Now, but bear in mind, it's version 1. So we will be continuing to add functionality as we go along. Vega, over to you.
Thank you, Liz. So right at the start, when a user signs on to our app, before they can begin to use it, they're required to enter some basic information about themselves. For example, in this case, we see that they have entered their gender, their month and year of birth, height, weight, etc., smoker status, basic level of physical activity, and so on. Now, this information stays on the device. It is never sent to us or to any other location. So in terms of user data privacy. This information is then used to filter queries as the app observes them on the blockchain. So to give you an example of what the query might look like, a seeker of health information might want, for example, in this case, to do a survey about health engagement and how it correlates to the individual's sense of well-being. So here we see, for example, the query contains the seeker's name, the title of the query, the detailed description, which should contain the purpose of why they're conducting that study, the amount of time they expect it to take for the user, the expiration date, and then, most importantly, the URL where the user will go to complete the survey. So when they broadcast this, they will encapsulate this data and broadcast this as a transaction on the blockchain. And the user's app will observe the blockchain. And as you can see here, there's 3 different cards for 3 different surveys that are available. So let's say the user is interested in doing the survey by First Health Insurance Company about health engagement. So they would click on that survey, and they see the details that the seeker had just sent out, for, as in the purpose of the query, the amount of time it takes, and the reward that's offered. So the user might decide this is agreeable to them. The number of tokens that are offered seems acceptable. So they will click on yes, take the survey, and they're presented with the URL that will take them to the seeker's website. So this is important because the data goes directly from the user to the seeker. It is never stored in our data center or on our servers, and it is never stored on the blockchain. So let's see what happens when the user clicks to open the URL in the browser window. And this is a small survey that we have for demo purposes. A real survey would be longer than this, but we don't have a lot of time. So let's just say I am highly interested in health issues, and I am very satisfied with my health. Submit. So the survey is complete. Could you bring back the app again?
Sure.
And let's see what the result is of doing that survey.
Okay.
So go back. And if we click on the wallet tab, here we see some recent transactions. And if we refresh, we might, if we're lucky and if the blockchain is fast, we might see the transaction that was sent. Looks like we are not lucky. But we should be able to see a card showing the transaction that was just sent by the seeker. And then from here on out, it acts just like any other cryptocurrency wallet. It should be able to send the tokens to redeem them for services, products, etc. Back to Liz.
Thanks, Vega. So in terms of our revenue model, it centers on 3 key components. Firstly, it's a network value where we want to create based on growing our user bases, a lot of quality partners, and how often the network is actually being used. The second thing is contributors to the network actually get a share of the transaction fee that is used to incentivize them to continue to use the network. Last but not least, we do plan to offer targeted info placement in the near future without compromising the privacy of the user, as the filtering actually occurs on the device itself, the user device, and not on the network, nor on the sender side. So in terms of market potential, connected health market is slated to hit $536 billion by 2025, out of which Europe and Asia each are projected to have a CAGR of average 30%. Given that we're predominantly a European-based company and 51% of the world's population sits in Asia, our focus will be on these 2 regions. So in terms of the roadmap, we have signed MOUs with public and commercial sectors in Switzerland and in Vietnam, as well as a lot of countries in the pipeline. We will be piloting with established user bases ranging from a few thousand to as big as 20 million in the next 6 to 9 months. After which we plan to go fully global by second half of 2019.